We have a roll call first on our agenda. Shelley or Adam?
We're going to introduce Adriana Smith.
Oh, Adriana.
Hello, everyone.
The microphones are in the field.
Oh,
You might want to walk over here.
okay. Can everyone hear me okay?
Audio.
Adriana will get her formal
Excellent.
introductions.
So I'm the new EMS coordinator. So I will be doing roll call going forward. So to begin, Dr. Woolridge, can you just say you're present?
I am present. Thank you.
Joshua Ziebler. Not present. Okay. Raymond Proa.
No, he's here yet.
Heather Berger.
Yes, I'm here.
Awesome. Thank you, Heather. Debbie Johnston. Ann Stafford.
I'm here. Thank you.
Thank you, Ann. Heather Miller. Oh, she has my G.
I was going to say, finger on. Maybe you can put your hand up, Heather, or take you there. Okay.
Are we good?
Yeah.
Okay. Jacqueline Evans. Tony Terrazino.
Present.
Thank you, Tony. Mickey Kovach.
Double finger.
It's up off mute. Mickey, we didn't capture
there we
you,
go.
but you can type in the chat as well if you'd like.
Okay, hands raised. Thank you, Mickey. Tony Duma. Okay. Jordana Carpenter.
I'm here.
Thank you, Jordana. And that is, so we have 7. So
Dr. Ziebler just joined.
oh, we have 8. Thank you.
And Mickey Kovacs just joined.
Excellent. So we have quorum, Dr. Woolridge. Thank you.
Great.
Hey guys, Josh
Thank you so much.
just got on.
Okay, great. Thank you so much, Aubrey. And just as a friendly reminder, as with all committee meetings through the Bureau, if you miss 2 consecutive meetings, the Bureau will contact you to ask if you're still interested in serving on the committee. Again, thanks everybody for attending. Moving on with our agenda, we do have a vacancy. Our pre-hospital coordinator position for PACES is vacant. Chris Ramos, a very valuable member, had to step away. So in our next meeting, we'll be looking towards voting in a replacement for Chris. If you have any good suggestions and want to nominate somebody, please let us know. You can put it in the chat or email Aubrey or Adam. You can also self-nominate. And we'll be looking for that replacement member for Chris. And if you have an opportunity to thank Chris for his service, we did appreciate having him on the committee. Next is to just make sure you're aware that our 2024 meeting schedule is posted on the Bureau website. Please take a look at that so you can have the dates for our quarterly meetings and you can get those squared out in your calendar. We're going to move now to discussions and action items. We have the department update from Chief Garcia.
I see that, Mickey, you have a hand raised. Did you have a question?
No.
Apologize, I didn't see that.
Sure. Chief Garcia is not here, so I can just run through briefly some of the Bureau report for her. We won't go through all of this, just if we did cover quite a bit of this in the previous meeting, but we do want to recognize that this week is Crash Responder Safety Week. There have been a number of events just recognizing all of those who respond to the pre-hospital environment, and so wanted to make sure that we took a minute to recognize everyone with this week. Next slide. We also do have the new trauma dashboard. We are going to go through some of this later on the agenda. This is just a snapshot of all of the work that we see put in from our trauma centers, as well as our SAB and CHEPI committees and our team here at the Bureau. So there's just a wealth of information and quite a bit of pediatric specific information that we're excited to share with you later in the meeting. We can skip through these. Just a quick legislative update. Chief Garcia does a much better job with this, but she is doing quite a bit of sessions around the state just on the implementation of House Bill 2609, which is specific to DON. And the rulemaking update, just reminding everyone that they're happy to practice updates that were completed in 2022 and 2023, and then some pending rulemaking specific to ground ambulance rules and EMC certifications as well. Quick word on the naloxone leave behind program. Adam, do you want to cover that?
Sure, yeah. The naloxone leave behind program is now live for any EMS agencies interested in participating in that. I'll drop my name, my email in the chat for you. The naloxone leave behind kits are intended for EMS personnel to leave behind at-risk populations that they encounter. They include what you see there, a couple doses of naloxone, and a couple of resource cards. The resource cards are specific to the region in which the naloxone is being distributed in. This is how we are affecting that opioid crisis. And so let me know if you'd like to participate. Thank you. I could do D if you want the workforce.
Yep, that's right here.
We've also been item D, the EMS and trauma needs assessment. We've also been around the state conducting lots of stakeholder collaboration sessions to gain their feedback from regional partners and other types of organizations. We are listening to them, learning from them, planning and prioritizing, and then once we take all of this feedback, we'll compile it. We'll add it to our slide set and then distribute the slides. We would hate for everyone to only see this information one time. And so we're taking perpetual feedback on that in this process. So please, have your voice heard while the window's open for it.
Next slide. Yep. I think we are probably good on that. I will just come back and do a quick welcome to our new Bureau staff. So we have already welcomed Abriana. So welcome to the Bureau as our new EMS Facility Coordinator. So I do want to take some time to welcome our other staff. We have here in the room with us, Marielle, who is joining us as part of the SHARE program, an epidemiologist. And we have Trustee Johnson, who's also going to be joining us, and then Karen Barnes, who is new to us as part of this DON team, and Erin Henderson, who is also new to us as part of the DON team. So big welcome to everyone that is new to the Bureau. And we can move along. I'm not sure if we have Carissa. I do see Carissa on the line next.
Oh, okay.
Oh,
I'm just trying to keep up. So yes, item E would be next. I'm sorry, I interrupted Dr. Bradley. I apologize.
No, not a problem.
All right, I can go. So good afternoon, everyone. Just for your guys' awareness, the Bureau had noted an increase in ATV incidents over the last few years. And because of this, we'd started working with the Arizona Game and Fish Department to promote an ATV injury prevention program. They currently have a program called Quail Kids. And so we're kind of working with them to update that program and because it was a little bit dated, but we're working with them, and the goal is to have a program that the trauma centers can use to do a little bit of ATV outreach and that kind of thing in their communities. So we did a pilot program with Mount Graham, and they shared that Quail Kids program at an event that they did. And so we got some feedback from them, and we're going to apply that to the program. So it's still in the early beginning stages, but we'll keep you guys updated as we progress, and we'll post any updates to our DQA webpage. And I'll go ahead and put my email in the chat if any of you are interested in being involved.
Great.
Thank you, Carissa, very much. Anyone want to discuss option F? I don't see an individual listed there, but the Arizona Trauma Dashboard, visualized data.
Sure. Yes, we wanted to just take a few minutes, if it's okay with the group, to go over some of the trauma data that we have. So I'm going to drive here on Shelley's computer. So this is the newly published trauma dashboard. So just to give a little bit of background to this group, historically, the Bureau has put together a STAB annual report, which is an annual report called trauma data. That was PDF documents that was required to be made statutorily, that STAB approved and would go to the director for final approval. Over the last several years, Bothell and her team have developed several Tableau dashboards, and we recognize there was the ability to make a more real-time data dashboard versus the PDF documents. And so this was approved as a new format. So I will go through some of these tabs because I do think there's quite a bit of pediatric-specific data, and we wanted to make sure that this group has an opportunity to see some of that. So the first page that you'll see here, it's just an overview of the trauma system. We love trauma centers by year, by level 1 versus level 3 and 4. We then can go on the next tab to the snapshot. If you look here, the snapshot can be adjusted. So we have 2017 through 2022. So this is a snapshot of the overall trauma system in the state. You can see here's the number of trauma incidents in the state, the number of trauma centers. Then we also have information of protective devices for injury prevention program. And then also here at the bottom, you see potential effective drug or alcohol use along with the age brackets for that area. The next tab is on demographics. We have here, at this point, it is filtered for 2022, all trauma centers and all age groups. For this group, if we want to filter down the 0 to 17 age group, you'll see how some of these graphs change. So you see definitely a variance in obviously the ages here. So we see kind of an increased rate in 0 to 4, and then in the 14 and older group, we see that uptick in trauma. And then we also can see the trauma intent documented here. For trauma mechanisms, we can adjust again once we have the 0 to 17. So just to give an idea, if we do all age groups, this would be all age groups, what your trauma mechanisms look like. And then if we filter to 0 to 17, you see that those percent changes. So you see this change here. Then you also see the relative information regarding suspected drug and alcohol use, admission rates, reimbursement and charges, ethnicity, as well as age and gender specific per 100,000. And these can also be delineated level 1 versus level 3 and 4. And when we go to the assault table here, this is 2022 data. So this lists all types of assault. You can see here specific to pediatrics, the suspected child abuse at the bottom here, that percentage. And then we see the rate specific variable here. And definitely note when you see this uptick of kind of the entire spectrum of assault, you see that 0 to 4 peak in that age group for pediatric. And then you do not see an increase again until over 40. So definitely recognize there's some very pediatric specific data elements there. Next tab is transportation to the hospital. So this demonstrates how patients get to the hospital with air, ground ambulance, or privately owned vehicle. And this is a trauma center map that we wanted to make sure was included so everyone had an idea of where the trauma centers were across the state of Arizona. So I'm happy to go back to any of these tabs. There's definitely certainly the demographics and the trauma mechanisms are really where we should focus on more 0 to 17 age groups. But I know there have been an ask previously to make sure that we identify pediatric specific data. And so hopefully with this new version of the dashboard, we have accomplished that.
Do we have any questions from those in attendance? I know we went through the Bureau reports pretty quick, but maybe take a moment and make sure that there's no clarifications that you all are in need of or questions. Thank you, Dr. Bradley. Any questions from the group?
Thank you.
We can go ahead and give the updates, Dr. Woods, if you'd like.
Okay, please.
Sure. Aubrey, you want to take care of the first one?
Yeah, so the Bureau is offering a free didactic NRP training for paramedics throughout the state. When Adam started the program, they had over 250 applications for registration. That number is quickly declining. It's in the 100s now. So I'm going to put a link in the chat. That way you can provide this to all the medics in your communities. And that way we can get this free didactic NRP training out.
Thanks, appreciate it. So Aubriana drop the training in the chat there for that. So we have about 100 licenses left, and that's out of the American Academy of Pediatrics, and that's focused toward little kids, neonate, and the management of them. We have just recently also identified additional funding for more of those licenses. We're able to spread that out a little bit further. Thanks, Ben. Item 5B, the NCIMSO Pediatric Emergency Care Council. A couple of updates out of them. They've recently identified funding for real world crash testing information regarding pediatrics. Currently, there exists no papers with evidence on it that suggests any one method is better than the other. So the NCIMSO Pet Council is in the first phase of drafting crash testing methods for a couple of different commercially available devices. This is the first of 3 phases, and at the end of phase 3, then the NCIMSO Pet Council should be able to make a recommendation on pediatric transport devices with empirical data behind it. Let's see. Aubriana, do you want to update C? 5C?
Sure.
The cards?
Yes. So Adam and Julia were instrumental in developing these cards. They're specific for car seats to provide indications of children in specific EMS emergencies. And so I will put the link in the chat so that you can have access. We have packs of 100 that we're able to give out to whoever would like to have those for either their agency or anyone they think this could be useful for.
Right, another fantastic resource. Thank you so much. So those are essentially car seat stickers. This was a fulfilled request from a stakeholder a while back asking for car seat stickers, but we thought we could fancy called Epic stickers that they serve the same purpose. They're adhesive and they can be wherever you'd like them to be for whatever parents, wherever you think as parents that information be useful, but they're initially designed for car seats. I can comment on the item D, review document of the emergency guidelines for schools. So a while ago, we were approached by the Arizona Department of Education to help. They requested us to help have us update their school medical protocols for those school nurses, they had asked us only a couple of items in the table of contents to update, and we did that. But what we noticed is that in those updates, we believe that there's probably a lot more that needs to be done. A few of the changes we made could be made in line throughout the entire document. So we're going to go back to the Department of Education and see if we have an extended timeline for that. Because from what they gave us versus what we saw that they needed, probably a lot longer than what we had initially set aside for ourselves. But thank you, Dr. Orge, and thank you, Jordana, for participating in that. I will be back with you, and we are looking for volunteers for that group to help us review emergency guidelines. I do need to get some further guidance from the project lead on that to see what direction we're going with that now. So I guess what I'm saying is sort of stand by on that if you'd like to participate, and I will let you know. Item E.
Yeah, so we, as some of you know, we have a standing work group for the EMS recognition program. We are still soliciting members for this program as we have our, I have to give a shout out to Jordana. She's our fan representative, and she's been instrumental in developing the EMS recognition program that we're planning on having launched by 2025. So this work group will, help us to review the applications and everything that's required in the materials. So if anyone's interested, please let myself or Adam know, and we would greatly appreciate any insight you could share.
Great. Great. And then the all grant group meeting? Yep.
Sorry, I see Ms. Eater has a hand up.
Yeah, before you move on from the one with the Department of Education, there was a new Senate bill, I think it was 1315, and in there is a requirement for education on heat-related illness for their athletics and other programs where students are exposed to the heat, and also on cardiac response as well. So that I can send you the language of this bill. We did have the ADHS legal team take a look to see what cascading component for us might be with assistance in that kind of training. But there's a lot of requirements for kids and the Department of Education as it relates to heat, because there were several kids, as you know, that had, heart attacks and cardiac issues. So I'm happy to share that information. I don't know if that's specific to what they want you to do, but it might help shed a little bit of light.
Thank you, Teresa. Would you be willing to put your contact information in the chat, or however else that you would like them to reach
Sure.
out to you?
Yeah.
Great. Thank you for that.
Yeah. Thanks, Teresa.
Okay, and then Adam, comments on the all grantee meeting?
Yeah, sure. We recently returned from our all grantee meeting. This is the sort of main meeting for our grant, for the EMSP grant. Jordana and I went. We were actually fortunate enough to present some of our particular Arizona children, what am I trying to say? To present some of our leading pediatric programs to other states that we're interested in. So kind of a twofold thing. We got to talk about our hospital recognition program for pediatrics, as well as they were particularly interested in Jordana and her new her status of contractor with us. The other states are interested in that as well. And so other than us giving presentations, there was just a couple of voting items for change of staff members there, and some discussion on pediatric readiness. This is a once every 5-year assessment. It's a large nationwide assessment that they were getting us spun up on, which you will starting to see. We'll start making announcements for in the new year. That's what I have for grantee meeting. Dr. Woolridge.
Great. Thank you guys for those updates. Any questions from the group? Okay, hearing none, that steps us to our next agenda section, which is the discussions and the action items. First is to review and approve the PACES meeting minutes. Can I have a motion to approve those minutes?
Jordana, I'll motion.
I'll second. Seidler.
Thank you, Jordana. Thank you, Josh. So in reviewing those minutes, are there any discussion elements or edits that anyone would like to propose? Any amendments? Hearing none, I would like to call for a vote. Can I have a motion and a second to vote on that?
Sure, I'll motion or second, whichever line I'm in.
Thank you, Josh.
I can second. This is Heather.
Thank you, Heather. Okay, so that being said, all those in favor say aye.
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 All those opposed say nay. And anyone in abstention? Okay, the ayes have it and the meeting minutes are approved. Thank you guys very much. Our next action item is to discuss, amend, approve the draft updates to the bylaws. This is a holdover from our July meeting where we didn't have quorum. So as we're looking at those through the screen and on your agenda where they were included, please let us know if you have any questions.
I'll just kind of update a couple items if you want to scroll fast, just so the group is aware why we have included in the bylaws the requirement about the courses there. Because these are subject to open meeting laws, we just have to have certain course requirements for participants on the committee. And we've had some issues with certain members of some committees not completing the requirements. That was why that was added to the bylaws. And then also further down to the voting, we also have been told that we need to make sure we capture votes accurately. So if you want to be captured as attending and voting, we just need to have you either here in person, on the phone, identifying yourself by name, or virtually on the computer, either coming on camera or typing your name in the chat to capture your attendance.
Thank you for that, Dr. Bradley. And some of you may be aware, all the committees had some of the bylaws updated to kind of follow that same housekeeping theme. Okay. Having reviewed the bylaws, I would ask for a motion to discuss and ultimately approve that. Can I have a motion?
I'll make the motion to discuss and approve.
Thank you, Tony.
Mr. Dan, I'll second.
Thank you, Jordana. Any comments about the bylaws? Any concerns, any discussion items? Hearing none, I'll call for the vote. All those in favor of approving the bylaws as you see them displayed would say aye.
Aye.
Aye. Aye.
All those opposed would say nay. Anyone in abstention? Okay, I didn't hear a lot in the way of vocalization. Shelley, did we get a count on that? Do we have?
Sorry, I couldn't get to my mute fast enough. This is Anne.
Okay.
Aye.
Thank you for that. I run into that problem all the time. Okay, hearing no abstention or nays, the ayes have it and the bylaws are approved. Thank you for that. Okay. Our next discussion action item is item C, to discuss the Education Committee's vote on approving the draft pediatric seizure training. For those of you who were not at the education meeting earlier today, these were reviewed and discussed at that meeting. Adam, do we intend to display those, or are we going based upon our previous review of those and that they're in the agenda?
Yeah, we are in the background working on an EMSC website, a standalone website where we're just going to put everything in one-stop shopping. You know, if it has to do with me, we're going to send you to this website. So that's where we're going to display these types of trainings in the long term. For the short term, I don't have an answer for you. I imagine just on the immediate Bureau's website under continuing education for the moment. But the goal is to get it on a one-stop shopping for the EMS for Children program long term.
Understood.
Good question.
Well, I would, this is a discussion item and not an action item for voting. So I would encourage everybody in attendance to take a look at those modules. They're excellent and they're great resources that can be used for training in your own agency and CE compatible in that manner. Any comments or questions about that? And the same conversation goes with the airway management module. There was the two that were reviewed earlier today. Any comments or discussions? Shelley?
This is Shelley. They were approved at Education Committee, and I'll probably get them publicly posted later today or tomorrow.
Okay.
And these are ready to be shared, so they are ready for distribution as you take them onto your agency. So they're meant for that style of distribution.
Yeah. Discussion in the Education Committee was pretty minimal. For the seizure module, it was sole discussion was clarification of the dosing of meds, which was confirmed. And in the airway management, there was one edit. And it was an issue of scope of practice where one slide said diagnosis, where that word was changed to impression instead. So really no changes in the existing slides that you saw during the education, or that you could have seen during the Education Committee, included in that packet. Okay, any comments or questions? Okay, moving on, standing item to discuss, amend, and approve the work groups and work group topics. We do have a new process. Adam, would you be willing to kind of summarize that for the group?
Yeah, sure. Because Education Committee meets before PACES, in order to streamline things, we thought we would, if there was a suggestion for training for pediatric training topics, that we would have volunteers from PACES go over to the education work group to work on it there. And so that way we kind of streamline and make this a little bit quicker of a process. Right now, it looks like, at least from my vantage point, I don't think we need any additional work groups. Soon, we are going to start utilizing the standing work group for the pediatric recognition program, but we don't have enough content there for them to kind of get into just yet as we're developing that. But I don't see any need for any work group unless you do, Dr. Woolridge, or unless anybody else does for any reason.
No, I don't.
Okay.
Okay. All right, well, thank you for that. And then item E is to nominate and vote for a position for the PACES Vice Chair. As I mentioned earlier, Chris Ramos had to step away from the PACES Committee. That left the vacancy because he also served as our Vice Chair. He also served as our Education Committee liaison. So these are positions that we'll need to fill going forward. But as of today on the agenda item would be to look for nominees to be Vice Chair. The role of the Vice Chair would essentially be to work with myself and the coordinators in establishing the agenda, guiding the work groups that we do work on, and to help liaison with the other committees as we move forward. Obviously, if I cannot be in attendance, the Vice Chair would step in as the chair of the meeting. Does anyone in the group have a nominee? This needs to be a committee member, and self-nominees are acceptable. Is anyone interested, or does anyone else want to throw anybody else under the bus?
Board member. Has to be current board member.
Yeah, the Vice Chair,
I didn't know.
Chair and Vice
you-
Chair.
Yeah.
Yeah.
It has to be current. Yes, correct. Has to be a current PACES member.
Ms. Jordana, I might be interested. I'd like to talk further about it offline if that's okay.
Absolutely.
Thanks, Jordana. We'll circle back around with you.
Okay.
Thank you.
Anybody else who would like to either nominate or to self-nominate? Hey, Jordana, looks like we're going to be trying to talk you into it. Okay, good. Yes, I look forward to discussing it further. Hopefully it's a good fit going forward. Thank you for that. Thank you for your interest. Last agenda item here would be to consider anything that anyone in attendance would like to suggest for our next meeting's agenda. Any suggestions on topics that we would discuss going forward?
Go for it. Yeah, Dr. Woolridge, sorry, there's a gentleman in the room that would like to introduce himself as a candidate for our pre-hospital coordinator seat. His name is also Chris.
Yeah.
Would you like to take a minute, Chris, to introduce yourself?
Yeah, hello. Thank you for having me. My name is Chris Gilbert. I am the pre-hospital coordinator for Phoenix Children's Avondale, currently fulfilling the role also at the main campus until we backfill that one. So other than that, I appreciate you guys having me. I've been in pediatric emergency medicine as a nurse since a new graduate about 10 years ago. Worked at Phoenix Children's initially. Went and worked at Grand Old Children's Hospital in the emergency department, part of their critical care transfer team, and just returned back to Phoenix Children's for this role.
Very good. And you're doing both for Avondale and main campus?
Currently right now,
Very
yeah.
good.
Yeah, as we continue to grow this program, we'll continue to grow with coordinators at the Avondale location and Mercy Gilbert as those two open as well. So hopefully we'll have 4 base hospital coordinators going forward.
Very good. If you're indeed interested, if you could submit a CV and a letter of interest, and we'll get you on the agenda for the next meeting. We'll go from there.
Sounds good. Thank you.
Either.
Gotcha. Sounds good. I can do that. Yeah.
Dr. Woolridge, that's everybody we have in the room for that.
Okay, well, Chris, it was great to learn a little bit about you and great to hear from you. We do have that vacancy in the pre-hospital position for PACES.
Mhm.
So look forward to discussing with you further. Similarly, the call to the group was if there are any other nominees, this would be the time to submit them forward. Please send them to Brianna. If you have interest and or I identify someone else who may have interest. Last agenda item would be a call to the public. Any other announcements that we have from the group?
Dr. Woolridge, this is Gail. Just the one reminder is we will need to get a representative from PACES to the education committee. So we've been putting that on the agenda for today, but we will need to get that on there. So if anyone is interested in being a PACES representative on the education committee, you can kind of think ahead of the time and let Brianna or Adam know. And that way we can get that on the agenda for the next meeting.
Great, great. Thank you, Dr. Bradley. And for full disclosure, I'm filling that position currently as interim until we have that elected member going forward. As alluded to earlier, I was at the education committee today for that purpose.
We don't really use proxies, Dr. Woolridge.
Oh, okay. Well, I attended anyways.
It's you.
I didn't vote, I promise. So, okay, fair enough. Thank you for that clarification. Upcoming events, we have the Tribal Opioids and Substance Abuse Conference displayed on your screen, November 15th, 16th. We have the 14th Annual Southwest Trauma and Acute Care Symposium, November 16th and 17th. The AIMS EMSC Fall Forum, that's virtual on December 7th. NAMES 15th Annual Arizona Pediatric Symposium, March 4th through 5th. Please visit the Bureau's News and Conference page for additional upcoming events and the training program page for upcoming CMC opportunities. So a lot going on going into the holiday season, so it looks pretty active. Our next meeting is going to be March 21st, 2024, same time, virtual, but also located in person at ADHS headquarters. With no other comments from the group or announcements, I think
we do. I think we do have a comment. Tony had his hand up.
Oh, Tony, I'm sorry. I keep missing these hands through the
That's
meeting.
quite all right. I just have an
appreciate
addition for the NAMES 15th Annual Pediatric Symposium. We are trying to bookend that either the day before or the Wednesday after with the pediatric ITLS class as well. So knowing that our next meeting is after that date, if anyone has any interest in that, please feel free to reach out. Thank you.
Great. Thank you, Tony. I'm pausing briefly just in case there's anyone else who has anything to mention. Otherwise, we are adjourned and we sure appreciate everybody's time and attendance. Thanks,
Thank you,
everybody.
everyone.
Thanks, everyone.
Thank you.